Hi, welcome to ACC 2023, and we're talking about elite athletes and the return to the field. I'm joined today by Kate Martinez. Welcome, Kate.
Thank
an
you.
undergraduate student doing research. Great to see you. Joined also by Michael Ackerman. Welcome, Mike. And Matthew Martinez. So talk to us. Tell us what you did and why you did it.
Yeah, so we put together a cohort of 76 elite level athletes that were participating at the Division I collegiate level and professional level. They had genetic heart diseases, but after proper risk stratification and shared decision making with 4 experts, 2 of which are standing right next to me, they were able to safely return to play. Of the 76, we are happy to report that only 3 had a non-lethal breakthrough cardiac event, and we hope that this is a message of hope for athletes all around the world, that they are able to return to play even with genetic heart diseases.
No, that's great. Tell me about the genetic diseases they had. HOCM, long QT, those were the major ones?
Yes.
How many have those?
50% had hypertrophic cardiomyopathy and about 25 had long QT syndrome.
What's this mean, Mike, for elite athletes?
I think this is great news. I mean, we've known for athletes sort of little league, junior high, varsity level that it's safe to return to play in most situations after you've been risk stratified, carefully treated, carefully counseled by somebody who actually knows their disease. But then what about the elite athletes? And now we have some data that even at that elite level, a safe to return to play is possible. So if you've been disqualified, get a second opinion.
So do you advise these folks to have a defibrillator handy on the practice field and playing field?
So it's all part of the process. So we definitely want to evaluate them. We want to risk stratify them. And then we do advocate that that there's an emergency action plan. The facility understands how to use an AED and hands only CPR. That's all part of how we care for athletes. This is just one part of it, but you have to do it all.
You do have to do it all. And I think educating people about the need for CPR, that was a big lesson from the Bills player, and immediate defibrillation, another big lesson. Well, thanks for your great work.
Thank you.
Great to see such a young person coming through the ranks.
Thank you for having me.
Thanks, Mike. Thanks, Matthew. Thanks all of you out there for joining us here live from ACC 2023.